Some scars may be sensitive, so doing desensitization with a washcloth across a scar will help decrease some of the areas that may be pretty sensitive, and you can do this gently across the whole scar. You want to first warm up the tissue with a gentle massage called feathering. It's very general, you're kind of just using a light touch with this one, and then you'll just be doing the area above, around the whole abdominal area just to warm up the tissue. And then after that, you'll go into gliding, which you'll be kind of just taking your fingers, then sliding the skin gently over the tissue underneath. And you'll kind of be doing this around the whole abdominal area as well. This is just to help warm up the tissue before you start doing the whole massage. With the smudging technique, you're going to use your fingertips to assist the skin to glide over top of the tissue that is underneath. And you're going to be going above, on, and below the scar. And you're not going to be breaking up scar tissue with this one. You're just assisting the glide of the tissue to move better around the scar area. And this one is a really good technique to help that collagen fiber lay a little bit more evenly underneath that area. With the circle technique, you're going to be using your fingertips to allow the skin on top to glide over the tissue that's underneath. And you're going to be doing clockwise and counterclockwise circles. And then both of these can be done above, on, and below the scar. And the intention behind this is to not break up tissue. However, it's just to help glide the tissue a little bit better. So you're not applying a lot of pressure. It's just enough to glide the tissue over top of each other. The long hold technique is a good one to allow the muscles and the tissue in the area that you're working on to relax. So apply gentle pressure, and then you'll just kind of pull the tissue gently into areas where you feel some restrictions. And this is just going to allow the tissue to move a little bit more evenly in the area. And then in areas kind of around the pelvis area, after a C-section, you'll notice that there's a little more restriction. So you'll kind of be pulling up the tissue in different directions where you feel the most restriction, and then just holding and applying a little bit of pressure.